I saw a number of patients this week who had heart surgery over the years. Two of them had coronary artery bypass graft surgery with ischemic cardiomyopathy, meaning that their heart was already very weak and dilated due to a very poor blood supply to the heart muscle. So the first patient I would like to share with you today had his surgery in August last year, so about 8 months ago, and he had been complaining of shortness of breath and chest discomfort. And while he was on holiday in Singapore, he collapsed, and his heart actually stopped beating. It had developed ventricular fibrillation, which is a heart rhythm where there is no cardiac output, so there's no ejection, there's no blood pressure. The only way out of this situation, if the heart is gone into ventricular fibrillation, is that we needed to defibrillate the heart. That is, we needed to give an electric shock to the heart to get it beating again. And fortunately for him, there were people in the park where he collapsed who were trained in resuscitation, and there was also an automated defibrillator nearby. So this was applied to him. He was given a shock, and his heart came back to life. So very fortunate indeed for him that he was successfully resuscitated following a cardiac arrest in a park. And some investigations were done. An echocardiogram scan was done. His heart function was very poor. His ejection fraction of the left ventricle was 23%. A normal ejection fraction is more than 60%, so it was very impaired. And a coronary angiogram was also done, and I'll show you the coronary angiogram. This is the picture of the right coronary artery, and the right coronary artery should continue right until there. You can see it gets blocked here, and beyond this point only small little arteries are supplying this part of the heart. So here a right coronary occlusion. And when we look at the left side, the left coronary artery, this is the left anterior descending coronary artery. It should continue all the way here, but it stops right there. So it had also occluded right here. So there was hardly any blood going to this part of the heart. And this is the circumflex coronary artery. You can see a very tight stenosis or narrowing right here. So it was difficult for blood to go to the heart also. So he was literally surviving on this artery. The other two had blocked completely. And this artery itself was very diseased. So that would explain why his heart had stopped and why he had become so unwell, and his heart function had become so poor. So he came for surgery, and we did 3 bypass grafts. Essentially, we sutured a new blood vessel onto here to bypass this narrowing. We sutured a new vessel here to bypass the blockage here, and we sutured a new blood vessel here to bypass this block area. And he did very well after his surgery. It was he had a very good recovery, but they do have a risk. There is a risk in patients with very poor heart function that the heart could stop again. So in patients in whom we have done coronary artery bypass graft surgery, if the left ventricular ejection fraction is less than 35%, then we would implant an internal defibrillator, what we call an ICD, so that if his heart should go into that ventricular fibrillation again, it will automatically give an electric shock to the heart and get it beating regularly again. In addition, we also look at dysynchrony, the presence of dysynchrony, to see if the heart is beating in a coordinated way. And in him, the ECG showed that there was some element of desynchrony. So we implanted an upgraded form of this ICD, what we call a CRT-D. So this is a very advanced sort of pacemaker and defibrillator, so it can both pace the heart so that it will beat in a coordinated way, and it can also defibrillate the heart if necessary. So he had one of these implanted before he went home last year, and he came back today to have his CRT-D checked, and also to have his blood test and an echocardiogram. He's improved a lot. He's completely well now. He's back to work already, and the CRT-D check was good. It didn't require any defibrillation, but it's always there as a backup if needed. And the echocardiogram showed that his ejection fraction had improved to 30%. So it is still weak, but it is better than the 23% it was before. And the other marker we look at is a blood test called the NT-proBNP. This was 5,000 before the surgery, and today it had improved to 500. So it had improved by 10 times. And that reflected how he's felt symptomatically. He was completely well and back to work already. So very pleased with him indeed. He is on some medications which our heart failure specialist is managing, and a number of medications do help the heart to get stronger. So this has to be continued until his ejection fraction improves, hopefully back to normal or at least above 35%. And we have to watch his cholesterol as well and his blood sugar to ensure that the coronary bypass grafts will last his lifetime. So that's one of the patients I saw with ischemic cardiomyopathy who had coronary artery bypass graft this week. A second patient I'd like to share with you today also had coronary artery bypass graft surgery with ischemic cardiomyopathy. And he had multiple coronary or heart stents over the years, but then he had got unwell and he had become short of breath last December. He had another heart attack and developed fast atrial fibrillation, that is an irregular heartbeat, and needed to be ventilated and started on inotropes. So he was very unwell. He had cardiogenic shock. The angiogram showed that he had severe coronary disease. So this is the injection of the left side. You can see this is the circumflex. It's actually stented. There are actually stents all the way here, but a new narrowing or blockage had developed after the stents. So very little blood was going to this part of the heart. And then this is the left anterior descending artery. It had also been stents. There are coronary stents in here, but it had become blocked after the stent. So there was no blood going to the heart. And this is the right coronary artery. It had actually all been stented, but again there was blockage developed after the stent as well. So he came for surgery. In fact, this patient, because he was so unwell and they needed to stabilize him for a period before his surgery, they implanted the ICD before surgery. So he had this automated defibrillator implanted. It's like a pacemaker where it's implanted either on the left side or the right side. And he had this implanted before the surgery. And then he came for his surgery last December. He had 3 bypass grafts and he made a very uneventful recovery. He came back today. He's much better. He's recovered from his surgery, and his NT-proBNP levels, which was running at 5,500 before the surgery, this is his chart. His NT-proBNP at 5,500 did go up after the surgery, and then it improved after the surgery, so it was about 500 today as well. So he's made a very good recovery. He does need to continue on his heart failure medications. He also had an echocardiogram today, and his ejection fraction had improved to 40%, and hopefully will continue to improve now that we have revascularized the heart, and also he's on the heart failure medications, which will help with that as well. So that's two cases with ischemic cardiomyopathy. Once the heart function becomes very poor, what we call cardiomyopathy, meaning the heart is weak and is also big, is dilated, then the risk of coronary artery bypass graft surgery or heart bypass surgery in these patients is much higher than those in other patients who have preserved heart function, whose heart function is still normal. But the benefit of doing coronary artery bypass graft surgery in this patient, the benefit in these patients are the greatest. So the survival difference between patients with ischemic cardiomyopathy who go for bypass graft surgery compared to those who just take medication or go for coronary stents, the survival benefit in favor of coronary artery bypass graft surgery is greatest in the presence of heart failure or impaired heart function. So these two patients will certainly benefit a lot in terms of an improvement in their survival, and also in terms of their symptoms from the coronary artery bypass graft surgery they've had done. So I hope that was informative. Please do like and share this video if you like it, and thank you for listening.